right? These are called microcytic anemias, right? Hypochromic, microcytic, just thinking small, think micro small. So we'll see RBC, hemoglobin, hematocrit low, and then we'll start to see MCV, MCH, MCHC also very low because the size of the red blood cells shifting. Now, in a perfect world, all of these things line up, right? You have your RBC, hemoglobin, hematocrit, check, check, check. We have our smaller blood cell size, MCH, MCHC, MCV, right? Check, small. And then we also see maybe our ferritin being low, our iron serum low, maybe our iron saturation low, and then our binding proteins would go up because they go up when our iron levels go low. There's more binding proteins. There's more fingers grabbing at things when you need it, right? Imagine if you're hungry, you're going to be grabbing that food with two hands, right? Think of the fingers as the binding proteins. Higher binding proteins typically is because you have lower levels of iron. But the big thing we look at is ferritin, iron saturation, and then we can looking at the binding proteins and the iron serum. And again, you don't need all of those to line up. The most important one there is going to be your ferritin. Absolute most important. And when you're dealing with patients, you may see lower ferritin and then CBC, right? Hematocrit, hemoglobin, all your indices, your MCH, MCHC, MCV, all these look good. And so that's why you have to really, I always start with the ferritin first because it tends to pick up things that your conventional medical doctor may not pick up when it comes to these problems with low iron. Now, with women menstruate every month, especially if you're, of course, cycling age and you're healthy and you're having a cycle. You're going to be menstruating every month, having your period. So you're going to be lowering that iron level. Menopausal women are kind of in the same boat as guys are. There's not that loss of blood every month. So you have to be careful of iron overload. And that's where giving blood once or twice a year can be really good. Just getting some good blood tests done can be helpful to lower that iron because iron can create oxidative stress, right? Think of oxidation of like an iron nail outside, right? It gets all rusty. That's oxidation. That can happen in your body. And so we utilize antioxidants to kind of help buffer that. So things that can help with oxidation would be like curcumin, resveratrol, glutathione, vitamin C. Vitamin C would actually increase iron absorption, but it's also a powerful antioxidant. So as a guy or menopausal women, you want to have good levels of antioxidants on board just in case you aren't giving blood regularly. And ideally get some blood tests done on yourself that will lower your blood and then also give blood. Those are all two really good options to get that iron level back to a moderate level. Now, the big three reasons why your iron's going to go low in most people, it's going to be vegan, vegetarian diet, partly because of not getting that animal heme-based iron, right? Plant heme iron has a little bit of influence, right? Like spinach, right? Go look on the ingredients, a lot of iron, but it doesn't necessarily move the needle on a lot of those markers I mentioned. Animal heme always does. That works really, really good.